everyone, and welcome to the Best Practices for Insulin Management webinar. Today's presentation is sponsored by the Good Health Gateway program, brought to you by Abacus Health Solutions. The Good Health Gateway program offers employers programs and services that encourage employees and their family members to take good care of their health. Our presentation today will cover the role of insulin in the body, specifically for those who have diabetes, what can influence your blood sugar and how to track it, as well as insulin types and methods for insulin management. At the end of the presentation, we will discuss the Good Health Gateway program and how you can benefit from it. Before we get started, I would like to introduce myself. My name is Danielle Taco, and I am one of the account service representatives at Abacus Health Solutions, providers of the Good Health Gateway. I will be moderating today's webinar. I am joined today by Dyer, a clinical pharmacist and certified diabetes educator at Abacus Health Solutions. Christine brings multiple years of experience working with people with diabetes and will be available today to answer any questions about diabetes and medication management. If you have questions throughout today's presentation, please feel free to answer them in the questions section of the GoToWebinar platform located on the right side of your screen. This will give you access to the questions box and additional resources. All questions are anonymous, so if time allows, at the conclusion of the webinar, we will address a few of the questions that come in throughout the presentation. However, if we are running short on time, we will respond to all questions directly afterwards. Throughout the presentation, we will be opening polls for the audience. You can answer some of these questions by using your computer. Please note that participation in each poll is voluntary and your answers are anonymous. After the webinar, we will send each of you a copy of the presentation. Now I'm going to pass things over to Christine, who's going to start the presentation.
Hi everyone, my name is Dyer, and I'll be speaking about diabetes and insulin management today. There are two types of diabetes. People with type 1 diabetes have a lack of insulin. Their pancreas does not produce any insulin. People with type 2 diabetes have a pancreas that does produce insulin, but just not enough that the body requires. So we'll briefly go over the role of insulin. Insulin is a hormone made by the pancreas. Insulin is the key that helps your body turn blood sugar or glucose into energy. After you eat, your blood sugar rises. This triggers your pancreas to release insulin into the bloodstream. Insulin then travels throughout the blood to your body's cells. Insulin tells the cells to open up and let the glucose in. Once glucose is in the cells can convert glucose into energy or store it to use later. Without insulin, your body can't use or store glucose for energy. Instead, the glucose stays in your blood. We briefly can talk about what influences blood sugars. Food, of course, does. Kinds of foods, specifically carbohydrates. Activity, an increase in activity uses up glucose for energy. So make sure that you eat enough before you won't go low prior to doing any exercise. Inactivity is just the opposite. If you're inactive, it causes glucose to stay in your blood longer. A lack of sleep, which I'm sure happens to a lot of people, myself included, causes counter-regulatory hormones to be released, such as cortisol. When your body has illness or infection, your body is under stress and will release hormones that may increase blood sugar. Stress, again, causes an increase in cortisol, and of course, certain medications, steroids specifically, will increase blood sugars. We can talk a little bit about carbohydrate counting. Carbohydrate counting is a powerful tool for both types of diabetes. As I said before, carbohydrates are what affect blood glucose. Depending on how many carbs are in a meal dictates how much insulin is needed. High-carb foods include bread, pasta, cereal, fruits, and dairy. If you eat carbohydrates, it is recommended that you eat complex carbohydrates instead of simple carbohydrates. Complex carbohydrates are released in the blood over a longer period of time versus simple carbs that are released into the blood almost immediately. Examples of complex carbs are 100% whole wheat products. Common myths in carb counting is that you can't eat any fruit. You can eat fruit, especially apples. An apple a day keeps the doctor away, they say.
Now, before we go to the next slide, we're just going to open up one of the first polls. So this poll just asks what kind of glucose monitor you use, if you use a blood glucose meter or a continuous glucose monitor. All right, and I'm going to close out the poll. And it looks like all of the members that responded to the poll use a blood glucose meter. So now we're going to talk a little bit more about those.
So when we talk about blood sugar monitoring, there are two different pieces of equipment. We can use a continuous glucose monitor or a blood glucose meter. A continuous glucose monitor, or a CGM, uses a tiny sensor under the skin that monitors blood glucose. The sensor then transmits the information wirelessly to the monitor. The monitor can be part of an insulin pump or separate. Examples include Dexcom or Freestyle Libre. A blood glucose meter uses a meter, lancets, and test strips. First, you lance a fingertip and touch the test strip to the blood. Then you insert the test strip into the meter for the reading. Examples of blood glucose meters include AccuCheck and OneTouch. When considering a CGM or blood glucose meter, be sure to check which monitor is on your health insurance plan.
All right, so by tracking your blood sugar levels, you can tell if you experience low blood sugar, high blood sugar, or both. I'm going to open the next poll for the audience, so let us know what your trends tend to be like. All right, and I'm going to close out the poll. And it looks like our members today have both high blood sugar and low blood sugar moments. So Christine's going to talk a little bit more about that.
Okay, blood sugar highs versus lows. With low blood sugar, also known as hypoglycemia, symptoms include sweating, irritability, hunger, lack of coordination, and sleepiness. To treat low blood sugar, take 15 grams of carbs every 15 minutes until blood glucose has stabilized above 70. Examples of 15 grams of carbs include 3 glucose tablets, 4 ounces of fruit juice or regular soda, not diet soda, 6 hard candies, or 1 tablespoonful of plain sugar. In cases of severe low blood sugar, a glucagon pen may be used. Important to train family members on how to administer it. And of course, low blood glucose is more dangerous than high blood glucose. With high blood sugar or hyperglycemia, symptoms include dry mouth, thirst, weakness, headache, blurred vision, and frequent urination. Think about what you ate recently or what medications you took recently. You should write the information down, as could be very important for your doctor. Talk with your doctor to make a plan during high blood sugar periods. Now we can briefly talk about insulin pens. Insulin pens are similar to syringes that contain pre-fill cartridges, one insulin type per pen. Some people prefer pens to vial due to their ease of use and they travel well. To administer insulin using a pen, bring the pen to room temperature, dial the dose needed, and inject. Pens can be stored in the refrigerator, but can also be stored at room temperature for up to 28 days. It is good practice to leave the pen you're currently using at room temp and store the rest of the box in the fridge until needed. Always remember to inject any kind of insulin at room temperature. Now we can discuss the insulin pump. An insulin pump is a small device that's easily disguised. The insulin is housed inside the pump in a little cartridge called a reservoir. Insulin travels into the body through a tube that ends with a tiny needle called a cannula that's inserted under the skin. It will give you your insulin automatically. The pump can also monitor your blood glucose levels, but doesn't replace the need for self-checking. Insulin pumps are mainly for patients who have type 1 diabetes, and they are great for people with frequent episodes of low blood glucose.
On our next slide, we are going to be talking about some of the types of insulin. So to test your knowledge, we're going to open the next poll. Which of the following is considered a long-acting insulin? Humalog, Insulin N, Levemir, or Toujeo? All right, so I'm going to close that out. And then it looks like the majority, or we actually got a 50-50 split between Levemir and Toujeo. So, Christine, if you would like to tell us the answer.
So the people who picked Levemir, you are correct, and I will explain the difference. So there are 5 different insulin types, and they mainly differ in their duration of action. A rapid-acting insulin, such as Humalog, has a duration of action of 4 to 6 hours. Short-acting, Humulin R or Novolin R, has a duration of action of 6 to 10 hours. Intermediate-acting, that's your Humulin Ns and Novolin Ns, duration of action 12 to 16 hours. Long-acting Levemir or Lantus has a duration of action of 24 hours, and ultra-long-acting Toujeo is a duration of action of 36 hours. So here's a travel tip. Humulin R and N and Novolin R and N are available without a prescription. So if you are traveling and you forget your insulin, you can go into any local pharmacy and purchase insulin without a prescription. Now we want to talk about insulin storage. Use the refrigerator for long-term insulin storage. As we discussed previously, bring insulin to room temperature for injection. Never store in the freezer or in direct sunlight, and always check expiration dates. Also dispose 28 days after initial use. Now that we've used our syringes, we need to talk about safely disposing of them. So you never want to put needles in the trash. You want to use a sharps container to dispose of used needles. An alternative could be a thick plastic laundry container with a cap. Find out from your local municipality where you can dispose of the container. Here in Rhode Island, we can just throw the container in the trash.
So to keep track of all of this information, you might want to use a management app on your phone, computer, tablet, or any other electronic device. But there's so many different apps on the market that you and every person you work with could use a different one to manage your health. When picking an app, it's important to find one that fits what you need, so you may have to try a few before finding the perfect fit. Some things to consider are, what functions do you need? Do you need something that tracks your blood glucose? Do you need something that will be able to sync up with your meter and your physician? Do you need something for exercise or nutrition? There's many different functions that you might need. Is the app compatible with your meter? If you have a meter that already comes with an app, usually the instructions are in with the manual for your meter, so you might want that so you can have automatic reception of your readings to the app. And then how user-friendly is it? Do you have to go through a few different pages before you find exactly what you need, or is everything laid out nicely on the front home page? Is there a fee for the app? Some apps come free when you get them, but then to get upgrades to certain features, you may have to submit a payment, or you might have to pay for the app altogether. But if that's something you want to avoid, there are plenty of completely free apps out there. And then what are the user reviews? Even though you should find an app that is individualized to what you need, user reviews might help you kind of get a sense of where to start. So they might tell you how user-friendly it is, or what types of information it keeps track of, so you have a starting point. And these are all important to consider when searching for the best management app for you. So what is the Good Health Gateway program? The Good Health Gateway program wants to bring all of the previous information together to help you manage your diabetes and prediabetes and reward you for doing just that. We strive to bring each member information that will help improve their health, prevent complications, and close gaps in care. We want to get you connected with your provider to get you the medications that you need to be at your best health with your diabetes. Since this is provided by your employer, each program has different rewards, and members complete specific activities that align with the American Diabetes Association's guidelines for diabetes management. On the screen, you'll see the care activities that are required for the Good Health Gateway program. These include an annual fasting blood lipids panel, an annual diabetes foot exam, an annual diabetes eye exam, an annual urine protein test, and a twice-yearly A1C test. Any of these activities that have been completed in the last 12 months can be used towards your rewards. And if your provider does not think that you need one of these labs or exams, they can tell us it's not needed and it will count towards your reward. The only activity that varies as a requirement by employer is meeting with one of our diabetes nurse educators or clinical pharmacists to create a diabetes health action plan. But if your program does not require this, our educators are still available for any questions that you might have. To find out if your program requires this, give us a call or check out the Good Health Gateway website. And even though this program is through your employer, our program is completely voluntary and confidential, so your employer will never know who is enrolled. All family members that are on the employee's health plan are eligible whether they have diabetes or prediabetes, and we reward you for taking care of your diabetes and prediabetes. As I said earlier, each employer program has different rewards and requirements, so check with our helpline or visit our website for more information. If you want more detailed information on any of the topics that we covered today, we've provided some resources which are up on the screen, and they can also be found in the handout section of the GoToWebinar platform. We will now be answering some questions, but please feel free to reach out to us in the future if you think of anything after the presentation. So, our first question is, what time of day should I be taking my insulin?
Yeah, that's a good question, and there really is no one right answer. It really depends on what your doctor tells you to take it. So some people will only have to inject once in the morning. Some people will have to inject before each meal and before they go to bed. So it really depends on your specific situation and what your doctor says.
And then the next one is, why would my doctor prescribe a long-acting insulin versus a short-acting insulin?
Sure. Sometimes patients need longer coverage with their insulin overnight. So instead of you having to get up in the middle of the night to give yourself another injection, they can give you a longer acting insulin before you go to bed that would cover you through the morning hours when you wake up.
And how will my provider know what type of insulin is best for me?
That's actually a really good question because there are so many brands of insulin and so many types of insulin. It really depends on if you have type 1 diabetes or type 2 diabetes, because both types can use insulin. It depends on how old you are. It depends on your lifestyle. It depends on if you're an active person versus an inactive person. So your physician will take into account your lifestyle, whether you're working or whether you're retired, to come up with an insulin management program specific for you.
Awesome. And it looks like that's all the questions that we have for now, but like I said, if anyone has any questions after the webinar is completed, please feel free to reach out to us. I want to thank you all for listening to our presentation today, and thank you for Christine for joining me. If you or a loved one would like to enroll in the Good Health Gateway program, please call or visit our website. And after the presentation is complete, we would request that if you could please fill out the poll after the presentation to let us know what topics you would like us to cover in the future. I hope you all enjoyed the presentation. Thank you so much, and have a great rest of your day.